Hello, everyone. Nice to see you again. Here we have a lesson about disease, illness, and symptoms. So, what is the difference between disease, illness, or symptoms? Okay, disease is in general. Okay, is in general something that occur for you that happened to you for a long time. For example, okay, but there is some treatment with that. Illness, it's kind of disease, but it's for short time happen. For example, on summertime, winter time, having something cold, flu, something like that. Okay, this is illness. Sometimes it's coming the symptoms after the disease. When you had a disease, for example, asthma, so this symptoms can uh, make for you trouble for your lung, for your health, for your breathe, for your something. So this is the symptom happen. If you have a head, for example, headache, can you get, for example, stress? Can you go? So this is the symptoms means the affection. Cool. So we have today very important that you need to practice it. Okay. Here we have some useful words and sentences and try to use it. How to say, for example, how do you feel today? How are you feeling? Or is everything okay? And this is the most useful sentences to use it when you ask for someone about his health or his feeling. Here you can say, I'm fine, I'm sick, not so good, not very well, I don't feel well. You can say, I'm sick, okay? You can say also, what's the matter? What is the matter? What is the matter? That's mean what's going happen to you or what happened to you? What's wrong? What's wrong? Okay, so what's wrong? W is silent here. Okay, what's the matter? What's the matter? You can say what's the matter is correct. What's the matter? Okay, what's the matter? Okay, here you answer. You can say, I have, for example, here, I have a headache. I have whatever. You can say, I've got a headache. So I have a headache right now. I've got a headache before 5 minutes, 10 minutes before 1 week, or before, for example, and it is still now. So it is something like present perfect, but it's still the affection till now. I got a cold, I have a cold, but it's still right now. Okay. I have a headache. I have got a sore throat because of something happened to me, and still I got problem of that. Okay, and here we have some vocabularies. We try to use it later. Okay, an allergy, asthma, a backache, a broken leg, cancer, cold, cough, diarrhea, flu, a fever. Okay, so all these vocabularies we are going to use it later. Measles can get red in the skin. There is something red in the skin, and because of fever, if usually when you get a fever, for example, especially on summer or maybe in winter, or if you have an allergy and mix with fever, so you can get red skin sometimes because of your sensitive skin, so you get red skin. So this is we call it measles. Okay, measles. Good. And sometimes you get a rash. Okay, and rush, when you get a rush, it's something like like a square in your body or in your skin. Okay, with white pimple they call it a rash. And sometimes a rash you can spread in your hand, in your under your elbow or something like that, in your chest. Okay, so they call it a rash. So a rash, it would be itchy. It can be itchy like that. Okay, we call it itchy. This is itchy. You can scratch it like this. So this is, they call it a rash. And here you can say also there is a sprain. A sprain can be twisted in ankle or hands. Okay, For example, like this, you got, or your ankle like this, okay, and you got a pummel, and you got it, your hand, for example, or your ankle get a bit uh, uh, um, a bit bigger, so they call it sprain. Or you have, for example, you have a tooth, a toothache, okay, a toothache, for example, you have problem, or you have a stomach. Here we have two pronunciation for the stomach. You call it a stomach ache, stomach, it is stomach, okay, and egg, okay, stomach ache, it is in USA. In British language, they call it stomach ache, the same but separately. Okay, so stomach ache British, stomach ache together. Good. Here we have an idiom. You can say under the weather. Under the weather. I'm under the weather today. I can't work. I don't feel good. I don't feel. I feel bad today. I'm ill today. Okay. I got a flu yesterday. I can't work today. I'm under the weather today. Okay. Under the weather. Not the weather, the weather, under the weather, under the weather, under the weather, correct. But when you are going to speak like an American, you can say under the weather, under the weather. Cool. Under the weather, we are going to use it later. Okay. There is another one. You can say take a turn for the worse. Take a turn for the worse. Okay, you are becoming more ill, more sick. Okay, for especially when you have a fever or when you have an allergy, for example. Okay, and when you have an asthma, something like that, you are getting more ill for that. So here's an example. Honestly, my health is taking a turn for the worse. I will not be able to work today. I will not be able for this week. I can't work anymore. Why? Because I still very sick. Okay? You can say, I take a turn for the worse. I'm not accepted to work today. Okay? I can't work today. Good. So here we got the phrases, very important. I will share it to you later. Okay? And the idioms. And here we are coming to the dialogue. Very important. Here, you look kind of green. You look kind of green. B, I don't feel so good. I'm feeling sick to my stomach. Feeling sick to my stomach. We have very good grammar here. We are going to review it later. Have you had anything to eat lately? B, I had fried shrimp, and clams for lunch. A, perhaps the food was bad. Perhaps, but I haven't felt well for a few days now. A. Has anything been absent you later? Has anything have been absent you later? Lately, sorry. My stress level is pretty much what it usually is. Do you think that maybe you are getting the flu? Do you think that maybe you are getting the flu? It seems to me like I may have caught a bug. Caught a bug. Very important word. Caught a bug. Good. And here advices. What do you do if you get a flu, fever, whatever? Okay? Buy some tissues. Tissues. Tissue or tissues. Here plural. Okay? Buy some tissues. See a doctor. Call to the doctor. Hi, doctor, please, I have a problem. Avoid running. avoid running. If you are getting sick, avoid running. Take some painkillers. Painkillers. Take some pills. Painkillers, they call it. Stay in bed. Stay in bed. Okay, don't go out. Take a hot bath. Take a hot bath. Not bath, bath. Take a hot, not hot, hot bath. Hot bath. Very good. Bath. Amazing. Get some cough. Lozenges. 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 Lozenges is like pills, okay? Or you can get it like sweet things with ginger. You can with lemon. You can get it with something like pills, okay? Especially when you have a cough, okay, and something like pills, you can just chew it like that. Chew it like chew it, okay, and you can eat it. Drink some lemon tea. Go to dentist if you have head, if you have a toothache. Stop drinking coffee if you have allergy. Stop drinking coffee if you have allergy. Put on some ointment, 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 something like oil or something like, for example, oil, a special oil or drops or something. They give you the doctor, put it on. Eat less spicy food, especially chili. Okay, especially if you have allergy, you don't need to eat spicy food like chili. Okay, avoid the flowers and grass. Avoid flowers and grass. Okay, grass, it's a green one, green plants. Okay, avoid it, especially if you have asthma, for example, or if you have cold. Sometimes there is some bacteria. Okay, so try to avoid it. Reduce screen time. Don't come close to the computer, to the screen, okay, because of your eyes disease maybe. Cool. Here we have two boys talking about, three boys talking about what they do if they are getting sick. So I always say, what does it kill you? Makes you stronger. That's why when I am sick, I just keep working. I once run a marathon with the flu. So he's sick and running. Okay, with the flu, I was sweating before the race even began. I don't like taking pills. He doesn't like it because he feels like he's strong. I think they just reduce my body natural defense. I don't even use bandits or band aids. He doesn't care, this guy. Okay, he doesn't take the pills. He doesn't care about his health. Okay, so because I think because he is an athletic. He's a sportman, something like this. Thorson, honestly, if I'm sick, I just stay at home. And do nothing. If I have a cold or the flu, I prefer homemade made remedies like ginger tea, and he preferred to stay at home and drink only tea. Okay, ginger tea and vegetable soup more than actual medicine. But if I have a headache, I take some painkillers. Painkillers, okay, like for example, Panadol or something. Right away, usually ibuprofen. Ibuprofen is for fever or headache. And the pain usually subsides within 30 minutes or so, or more maybe. Cool. Raphael, my mother is a nurse. Wow, that's good, like Shakiba. So I grew up in a house with lots of medicine. They don't care because they have lots of medicine. They think that can use it for every time. Mhm. And even today, I give a huge amount of bills, ointments, and residence in my apartment. Over time, my collections of medicines has expanded, and to be honest, I'm not even sure what half of them do. If I feel even a little bit sick, I don't go to the doctor. I just take a handful different pills and hope one of them works. So we are going to review the grammar. We are going to say something about very important vocabularies here where you can use it with a patient or if you are getting a sick, how to use these vocabularies with such as situations. Thank you very much. This is now we are